In today's video, I'm going to talk you through your treatment and management options if you have lateral hip pain, starting with some of the more conservative treatment interventions, ranging through to some of the more invasive interventions if necessary. And make sure you keep watching until the very end, as I'll also be talking to you about 2 things you should not be doing if you have lateral hip pain. And we're going to start right now. Many soft tissue injuries tend to be because of some sort of change in load or overload. Now, most of the tissues in our body respond very well to changes in load if that change in load has been done slowly, gradually, and progressively over an adequate period of time. What our tissues tend to not respond very well to is a significant change in load quite quickly, and a lateral hip is no different. So with that in mind, the first thing in terms of treatment that we need to be addressing is load management. If you're a therapist, you need to spend some time educating and advising your patient about the sort of activities that are going to load the lateral hip more. For the purpose of today, I'm going to be discussing that with you. Now, there's 2 things that we want to be addressing. The first thing are stretching and compressive forces around the lateral hip, and the other thing is load itself. In terms of stretch and compression, a few activities that might provoke this could be standing with a hitched hip, so your typical position you may be in if you've got a child on the outside of your hip or a grandchild, or sitting in a low chair, sofa or sports car. Now you may be able to just offload this slightly by sitting on a few cushions just to raise you up slightly and reduce the angle at the hip. Sitting cross-legged or bringing your leg across the midline of your body are also going to put the lateral hip on more stretch. So these are things you may want to consider adapting just for a short period of time. I just mentioned that the lateral hip could have become sore because of some sort of change in load, so it's definitely worth spending some time trying to analyse what that could have been. If you are a walker or a runner, it might be that you have started going further, you may have changed your speed, you may be doing it more frequently during the week, or you may be having less rest periods. You may find that a change in gradient has increased the load going through your hip. So typically lots of up and downhill runs or walks are likely to put more load through the hip than doing it on a flat surface. If you enjoy working out in the gym, it might be that you've changed something within your routine. You may be working through more range, you may have upped your load significantly. It might be that you have been doing low impact workouts and now you're doing higher impact workouts that include more jumping, hopping and landing. Now, it's really important to note that generally tendons, tissues, they don't like complete rest. So it would be much more beneficial if we can adapt and change and reduce things slightly. That means we can keep moving and exercising and letting things calm down at the same time rather than resting completely. Now, whilst you're going through this process and you're trying to work out what is the right amount, your symptoms will talk to you. They will let you know if you're overloading the area too much or if you're working at the right level. Now, things do not have to be completely pain-free, but at the same time, we don't want to flare things up. So the rule of thumb would be it's okay and safe to work into tolerable levels of discomfort. That is very subjective and completely up to you. But what should happen is that slight increase in discomfort from the activity should settle back down to baseline within 1 or 2 days. If that's happening, that's an appropriate level of discomfort to work into. If you feel that your pain is significantly increasing for a 3 or 4 day period and or it's not tolerable, that is a sign that we're just overloading the area of tissue a bit too much, a bit too soon. A quick interruption just to say I've recently put a shop together with lots of different exercise motivation and medical myth-busting t-shirts and hoodies just like this one. So if that sounds like something you'd like to wear down the gym, on your run, or even just down the pub, you can find a link to the shop in the description below the video. I really hope you enjoy the rest of this one. If this is the case, we don't stop completely. We let things calm back down to baseline and then we return to the activity. But again, we change some sort of variable to make it easier. We may do less reps or sets, we may do even less mileage or less speed, but we try and keep moving if we can. Direct pressure on the lateral hip can also be uncomfortable, so it's really common for people to say they don't enjoy sleeping on the affected side very much just because of the extra pressure on that bony area. The other thing to mention is that people sometimes find they don't like sleeping on the opposite side, and that is because the leg tends to just fall past the midline of the body, which puts the lateral hip on more of a stretch. Part of your treatment to negate this could be trying to sleep with a pillow between your legs just to raise the leg up slightly. So hopefully we have a few ideas on how to try and calm things down. At this stage, hopefully things are less irritable. We now need to try and build things back up, because essentially, although we've calmed things down, there's still this load intolerance within the tissue. So if we do go back to exactly what it was that caused it in the first place without building things up, there is a chance that we could flare things up again. Now, this simply means we need to try and get things a bit stronger. Now, I am going to be doing specific videos on exercises for lateral hip pain. When they're up on the channel, I'll pop a link to them in the description below. But for the purpose of this video, let's just have a quick chat about the sorts of things that you could include as part of your strengthening program. Specific exercises could include things like side lying or standing hip abduction, split squats or Bulgarian split squats, step ups or lateral step ups, bridges, single leg bridges, and crab walks are all things that you could include into your rehab program. In terms of optimizing your program, there's a few things you need to take into account to make sure that it works. The first thing is it needs to be a challenge. We're trying to stimulate adaptation and change in the tissue, and this will not happen if you find the exercises too easy. Second thing is it needs to be progressed. So as these adaptations occur, we need to stress it a bit more to cause more adaptation. So your program should look quite different in week 4 than it did in week 1, and it should look quite different in week 8 than it did in week 4. It also needs to be done for an adequate period of time. So on average, we're thinking around 12 weeks. However, this is going to vary significantly from person to person and definitely depends on the chronicity of the issue. If you've had it for a few weeks, you're more likely to get better quicker. If you've had it for a few years, it's likely to get better slower. And the last thing to say is it needs to be functional and it needs to replicate the sort of things that you are hoping to get back to. So if you are hoping to get back to running or sport, then it does need to include at some stage some hopping, jumping and bounding. So education, advice, load management and exercise are the gold standard treatments for lateral hip pain. We can talk about a few adjuncts. So one thing that could be appropriate, maybe in the early stages or maybe if you've had a flare, could be anti-inflammatories if you're allowed to take them, just to help with some short-term pain relief. There is this misconception that painkillers mask the pain and they're not doing much. That's not correct. If you are taking anti-inflammatories, there will be something going on at a cellular level to help decrease inflammation around the area. So they are appropriate to take if you're allowed to for a short period of time. A further non-invasive type of treatment is available for lateral hip pain is shockwave therapy. Now this involves a therapist pushing a probe onto the lateral hip and around the soft tissues in that area, administering shock waves. Now the idea or hypothesis around this sort of treatment is that the shock waves help to facilitate some tissue healing. This will typically be used if you are not happy with the level of function that you've achieved with an adequate period of rehab, and generally is used in conjunction with the rehab program itself. Moving on to some of the more invasive treatment options available for lateral hip pain. The first one would be an injection. Now, there's two situations where an injection is likely to be most appropriate. The first situation would be if your symptoms are highly irritable. So you're struggling to do the exercise, you're struggling to tolerate any load going through that area, and any exercise is flaring things up. It might be that an injection is going to give you some short-term relief so you can tolerate that rehabilitation. The second situation would be if you had tried the load management and exercise for an adequate period of time and unfortunately you just hadn't seen the level of improvement that you were hoping for, and or you just felt things hadn't changed very much. Now it's important that we appreciate an injection is not a quick fix. It's likely to provide short-term pain relief between 1 to 3 months, with 3 months being quite a good outcome. And in a perfect world, you would be doing some sort of rehab alongside the injection therapy in order to try and maximize your function. Now, if unfortunately you tried all of those conservative things and they hadn't worked, there are surgical options for lateral hip pain. But needless to say, they should always be last resort, and you do want to ensure that you have exhausted all of the things that we've spoken about today before you think about going down a surgical route. Now, I did say at the beginning of the video, if you did stay tuned until the end, I would tell you 2 treatment options you should not be choosing if you have lateral hip pain. And the basis for this is that there's very little evidence to support their use. One of them in particular is probably used a lot more than it should be. And the first thing that there is very little evidence for would be electrotherapy. Now, the second thing is massage. Surprisingly, deep soft tissue massage and massage is not supported in the treatment for lateral hip pain. We did mention earlier in the video that pushing or prodding in that area can be really uncomfortable. So if you do have anybody massaging or digging their fingers, knuckles or elbows into the area, you may actually find that it makes things worse and not better. So the advice would be, if you are seeing somebody that is using either of these treatment methods, it may be a good idea to look elsewhere. Thanks for watching. I hope you found that helpful. If you did, pop a comment below the video and let me know what adaptations you made to your routine to help improve your symptoms. If you did like this one, you may well like the one I have done on signs, symptoms and diagnosis for lateral hip pain, and there's a whole playlist on the channel to help you with your symptoms at home. Don't forget to like and subscribe so you don't miss any of our hip pain videos, and until next time, I'll see you again very soon.